When it comes to COVID-19, hindsight is definitely 2020.
No, I don't think it should be mandatory. I wouldn't demand to be mandatory, but I would do everything in my power, just like I don't think masks have to be made mandatory nationwide. I will sign an executive order that will now require all executive branch federal employees to be vaccinated, all. And I've signed another executive order that will require federal contractors to do the same. If you want to do business with the federal government, vaccinate your workforce. My message to unvaccinated Americans is this: we've been patient, but our patience is wearing thin.
But again, it's not solely vaccine-based. Other things have never had a vaccine and they go away. So I don't want people to think that this is all dependent on vaccine, but a vaccine would be a tremendous thing. And I will tell you, therapeutically or therapeutics, what's going on there is equally as impressive. A lot of good things have come out about the hydroxy. A lot of good things have come out. I happen to be taking it.
The overwhelming prevailing clinical trials that have looked at the efficacy of hydroxychloroquine have indicated that it is not effective in coronavirus disease.
Hydroxychloroquine. Studies are showing that this anti-malarial drug may have helped COVID-19 patients survive in the hospital. A team at Henry Ford Health System in the US said they studied 2,541 hospitalized coronavirus patients and that those given hydroxychloroquine were much less likely to die.
Dr. Vladimir Zelenko, who becomes known for using hydroxychloroquine to treat COVID-19, has been nominated for a Nobel Peace Prize.
It's important because it gives credibility to the message.
The FDA has been crystal clear. A horse dewormer should never be used to treat or try to prevent COVID-19. But that's not stopping popular podcaster Joe Rogan from pushing the drug.
Rogan, America's most popular podcaster, defended his use of the drug and even credited it with his quick recovery.
I literally got it from a doctor.
Most medical experts agree ivermectin is not an effective treatment for COVID.
If there were a medicine that would really help with COVID, every doctor around the world would be using it.
I am taking a regular dose, whatever. They're trying to build up of ivermectin. Ivermectin was a boogeyman early on in COVID.
You couldn't talk about it.
That was wrong. We were given bad information about ivermectin. The real question is why? The entire clinical community knew that ivermectin couldn't hurt you. I know they knew it. How do I know? Because now I'm doing nothing but talking to these clinicians who at the time were overwhelmed by COVID and they weren't saying anything.
This is the way Chris Cuomo talked about ivermectin in 2020.
You talk about cancel culture and who to shame. Ivermectin, a dewormer, really?
They are shaming themselves. No one has to shame them. They're shaming themselves.
No, they need to be shamed. They need to be called out and shamed, brother.
You consider a national mandate that people need to wear masks?
No, I want people to have a certain freedom, and I don't agree with the statement that if everybody wear a mask, everything disappears.
Masks, quite frankly, are more important for people who are infected to prevent them from infecting someone else. The drugstore masks that sell have a lot of loopholes in them that let the virus through.
It's going to come. Here we go.
A very different,
takes it off,
an incorrect message.
There have been two huge studies. One was the Danish study. It's published and it shows about a 15 to 20% efficacy of mask wearing, which was not zero, but not 80 and not 100%. People behave as though they're 100%. And wearing them outdoors makes zero sense, like none. But to treat people like they're some sort of wielding a murderous weapon by not wearing the mask.
Have you seen anything at this point that gives you a high degree of confidence that the Wuhan Institute of Virology was the origin of this virus?
Yes, I have. Yes, I have.
And what gives you a high degree of confidence that this originated from the Wuhan Institute of Virology?
I can't tell you that. I'm not allowed to tell you.
Former medical intelligence analyst says more evidence points to the virus evolving in nature. Newsy also learned that 2 former intelligence workers have heard of current workers being pushed to the edge to pursue conspiracy theories of the origins of the coronavirus.
Dr. Anthony Fauci now says he's not sure exactly how coronavirus came to infect humans and left open the possibility that the virus could have come from a lab.
Are you still confident that it developed naturally?
No, I'm not convinced about that.
So how did we get here? With America's most prominent public health expert saying that the lab leak theory, which was previously hawked by conspiracy theorists, might actually be credible.
And he wants to close down he will shut it down again. He will destroy this country.
The idea that he is insisting that we go forward and open when you have almost half the states in America with a significant increase in COVID deaths and COVID cases. And he wants to open it up more. You can't fix the economy until you fix the COVID crisis.
What do you mean now is a governor who refused to give in to the left's demands and lockdown requests, Governor Kristi Noem of South Dakota. You have been lambasted in the press for not stripping your residents of their basic freedoms and their right to work and go to school. Here we are about now 6 months into this pandemic, and South Dakota still has a death rate 11 times lower than New York's per 100,000 people.
Not only do we have one of the lowest death rates, we've got about 40 people that are in the hospital today statewide. Our infection rates are low. Our job losses are low. Our economy is doing better than virtually any other state. And I think it's a real testimony to what could have been possible in many of these other states. The governors just made the wrong decisions.
People are tired of hearing Fauci and all these idiots, these people that have gotten it wrong. Fauci's a nice guy. He's been here for 500 years. He called every one of them wrong.
There will be a surprise outbreak. There is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, but also there will be a surprise outbreak. The thing we're extraordinarily confident about is that we are going to see this in the next few years. Thank you.
One thing that's for certain, don't let it dominate you. Don't be afraid of it. You're going to be.
Thank y'all for watching. All opinions are welcome in the comments. See you on the next one. Peace.